Hey everyone, welcome back to the channel. Today, we're diving into a topic that affects millions of men around the world, erectile dysfunction, or ED. Specifically, we're going to be talking about medications for ED. Whether you've experienced it yourself or know someone who has, this is a really important conversation to have, so let's break it down. What is ED and why do medications help? First off, what exactly is erectile dysfunction? In simple terms, it's when a man can't achieve or maintain an erection firm enough for sex. This can happen for a lot of reasons: stress, anxiety, health conditions like diabetes, or even as a side effect of certain medications. Now, this is where ED medications come into play. These medications work by increasing blood flow to the penis, making it easier to get and keep an erection when sexually aroused. They're not an instant fix, meaning you still need sexual stimulation for them to work, but they can make a huge difference for men struggling with ED. Common ED medications. So, what are the most common ED medications out there? You've probably heard of a few, like Viagra, Cialis, and Levitra. Viagra, also known as sildenafil. This is probably the most well-known ED medication. It was the first to hit the market in the late 90s, and it's been a game-changer for many men. Viagra typically works within 30 to 60 minutes and lasts for about 4 to 6 hours. Cialis, tadalafil, another popular option. What's unique about Cialis is its long-lasting effects. It can stay effective for up to 36 hours, which is why it's sometimes called the weekend pill. So, it offers a bit more flexibility compared to other ED medications. Levitra, vardenafil. Levitra is very similar to Viagra in how it works, but some men find that it works better for them, especially if they have underlying conditions like diabetes. It's typically effective for about 4 to 5 hours. How these medications work? Now, let's talk about how these medications actually work. All of the drugs I just mentioned are what we call PDE5 inhibitors. Without getting too technical, these medications block a specific enzyme in your body, PDE5, that can restrict blood flow to the penis. By blocking PDE5, these medications allow the blood vessels in the penis to relax, letting more blood flow in when you're aroused, which helps you get an erection. Pretty simple, right? But remember, it's not like taking a pill and magically having an erection. You still need to be sexually stimulated for the medication to do its job. Side effects and safety. Of course, as with any medication, there are potential side effects. The most common ones are headaches, flushing, upset stomach, and nasal congestion. Some men might also experience dizziness or vision changes. It's really important to talk to your doctor before starting any ED medication, especially if you have health conditions like heart disease or if you're taking medications like nitrates for chest pain. Combining ED medications with certain drugs can lead to dangerous drops in blood pressure. Other options and final thoughts: if for some reason, the first medication you try doesn't work well, don't worry. There are other options, and sometimes it takes a little trial and error to find the right one for you. Beyond pills, there are other treatments available like injections, vacuum devices, or even surgery for more severe cases. So, if ED is something that's been affecting your life, the good news is that there are plenty of options out there. Talking to a healthcare provider is the first step to getting back on track. Consulting a specialist is crucial. Now, let's talk about why it's so important to consult a healthcare provider and not just go off what you think might work. I know it can be tempting to just go online, read about ED medications, and try something out on your own, but that can be risky. ED isn't just about not being able to get an erection. It could be a symptom of a more serious underlying health issue, like cardiovascular disease, high blood pressure, or even psychological factors like anxiety or depression. A specialist can run the proper tests to figure out what's really going on with your body. They'll help you find the most effective treatment that's safe for your specific health situation. Self-prescribing or getting medication without a doctor's input could not only be ineffective, but it could actually make things worse, or lead to dangerous interactions with other medications you might be taking. Trusting a specialist is key to making sure you get the right help in a way that's safe and effective. After all, your health is way too important to leave to guesswork. So supplements for ED can be a great first step. They're often plant-based or contain key minerals and amino acids that help support blood flow, energy, or even testosterone levels. But keep in mind that results can vary, so it's all about finding what works best for you. 1. L-arginine. L-arginine is an amino acid that plays a crucial role in nitric oxide production. Nitric oxide helps relax blood vessels, which means improved blood flow, not just to your muscles but everywhere. Several studies have shown that it can be effective, especially when combined with other supplements like pycnogenol. If you're interested in giving it a try, check out the link in the description. 2. Panax ginseng. Often called the herbal Viagra, Panax ginseng has been used in traditional medicine for centuries. Studies suggest it may help improve stamina, reduce fatigue, and promote better blood flow. Plus, it's generally safe for most people. Panax ginseng supplements are easy to find, and I've linked some top-rated ones below. 3. Horny goat weed. The name says it all. Horny goat weed has long been a go-to for improving libido. It contains a compound called icariin, which may help block certain enzymes that restrict blood flow. This supplement has a pretty solid reputation and some promising research behind it, so if you're feeling adventurous, take a look at the affiliate link below. 4. Maca root. Maca root isn't just for energy. This Peruvian herb has been shown to support sexual function and libido. It's known for helping with hormone balance, which can make a big difference if low testosterone is a factor. Plus, maca is easy on the system, so if you're curious, check out some maca supplements in the description. 5. Zinc. Zinc is essential for testosterone production, and many people are actually deficient in it. Low levels of zinc can contribute to low testosterone, which in turn affects libido. A simple zinc supplement can help restore those levels, potentially making a big difference in energy and drive. 6. Ashwagandha. Ashwagandha is often thought of as a stress relief herb, but it's also been shown to improve stamina and libido. By lowering stress, it helps with overall body balance, which can do wonders for energy and mood. Ashwagandha is widely available, and there are some great brands linked below. 7. Citrulline. Citrulline is another amino acid that helps improve blood flow by increasing nitric oxide. It's great for people who need a little more endurance in their workouts and other activities. Many athletes use it, and if you're interested, I've added a link to high-quality citrulline supplements. Alright, that wraps up our list of natural supplements for erectile dysfunction. Remember, while these supplements can help, it's also important to take care of your overall health with good sleep, a balanced diet, and regular exercise. Thanks for sticking around. If you found this video helpful, give it a thumbs up, subscribe, and don't forget to share it with friends who might benefit too. All the supplements I mentioned are linked below, so feel free to explore and see which ones might be right for you.